I'm going to talk about 5 commonly prescribed medicines for high blood sugar, including how they work, who should take them, and some of the problems that you might have while taking some of these medicines that your doctor probably hasn't warned you about. The first medicine I'm going to talk about is metformin, which is probably the most prescribed drug for high blood sugar. It's sold under various brand names, including glucophage, Riomet, Glumetza, and Fortamet. It comes in tablet form and also comes as a liquid suspension. It's prescribed so often for several reasons. First of all, it's safe, and it's usually the cheapest of all the diabetes medicines. It can help you lose weight, and it rarely causes your blood sugar to go very low. How does metformin work? When you eat, your blood sugar goes up. In response to this, your pancreas releases insulin, which is a hormone, and insulin travels around your body like a messenger, telling the cells that there's high sugar in the blood, that they should open up and remove this sugar from the blood. If the cells listen, they open up, take the sugar from the blood, and your blood sugar comes down. If you have type 2 diabetes, when insulin comes along and knocks on the door, your cells don't listen, they don't open up, they don't take the sugar from the blood. So the sugar stays in your blood and you have high blood sugar. Metformin makes you more sensitive to insulin. So when insulin comes along and knocks on the door, your cells actually start listening and they take the sugar out of the blood so that your blood sugar can come down. Metformin stops your liver from pushing glucose, that's sugar, into your blood when your blood sugar is already high. Because of the many benefits of metformin, you'll often find it used together with other medicines that also lower your blood sugar. The most common side effects of metformin are nausea, vomiting, and stomach pain. Some people also have extreme weakness and explosive diarrhea. You can also have low levels of vitamins and minerals in the body, like vitamin B12, vitamin D, and magnesium. All these can become very low, especially if you've been taking metformin for a long time. I have a video about the side effects of metformin and how to avoid them linked in the description. The next medicine is glimepiride, often sold under the brand name of Amaryl. Glimepiride is available in tablets of 1 mg, 2 mg, and 4 mg, and it's usually taken once a day with the first meal of the day. Well, remember that we said that in type 2 diabetes, when insulin comes along and knocks on the door, that your cells don't listen. Well, what glimepiride does is that it goes to your pancreas and it forces your pancreas to produce extra insulin. So basically, you have so much insulin in your body that your cells become overwhelmed and they're forced to open up and take the sugar from your blood. This way, your blood sugar comes down. Now, this can cause some major problems down the road, and I'll talk about those later. If you have high blood sugar and you haven't been able to bring it down by making changes to your lifestyle, then glimepiride might be prescribed for you. But you have to have a functioning pancreas. You have to be able to produce insulin. So for example, if you have type 1 diabetes where your pancreas is not producing insulin, then taking glimepiride would be useless. In terms of cost, glimepiride is quite affordable, especially compared to some of the newer blood sugar lowering medicines. What are the side effects of glimepiride? Well, you're going to have the side effects that are common for almost any medicine that you take, especially the ones that you swallow. So that would be nausea, vomiting, diarrhea, and possibly constipation. One dangerous side effect of glimepiride is very low blood sugar, and this can occur hours after you've taken the medicine, and it can also occur even if you've taken a very small dose of glimepiride. Another common problem with glimepiride is weight gain, and this is a bit of a problem because generally speaking, getting fatter is going to make your diabetes worse. The beta cells of your pancreas are the cells that produce insulin. By the time you get a diagnosis of diabetes, the chances are that you've lost about half of those cells. They've stopped working. So you're left with the other half. And when you take glimepiride, what you're basically doing is flogging the remaining 50% of those beta cells and forcing them to work overtime. This works for a little while, but eventually even those cells become exhausted and they stop working, which means that they're not producing insulin. And if your body isn't producing insulin, that means that you have to start injecting insulin in order to bring down your blood sugar. Another medicine that your doctor might prescribe for you is vildagliptin. And this comes in tablets of 50 milligrams, which you usually take once or twice a day. It's often sold under the brand name of Galvus. Vildagliptin works ultimately by increasing the release of insulin from your pancreas after you eat. And what this does is that it prevents the usual spike in blood sugar that you'd get after eating. Vildagliptin also reduces your appetite. Vildagliptin also helps you to feel full, so you're likely to eat less. Vildagliptin is more expensive than some of the older blood sugar lowering drugs, but it has a couple of benefits in that it doesn't make your blood sugar go very low because it basically acts when your blood sugar is high, which is after you've eaten, and it doesn't cause weight gain. What are the side effects of vildagliptin? Well, you're going to have the common side effects of nausea, vomiting, diarrhea, constipation, possibly. One slightly unusual side effect you might have with vildagliptin is nasopharyngitis, which is basically signs and symptoms of the common cold. So you might have fever, a blocked nose, pain in the throat, difficulty in swallowing, cough. And another side effect is swelling of different parts of the body. And this is more likely to occur if you're also taking some blood pressure lowering medicines like lisinopril. The next medicine is empagliflozin, which is often sold under the brand name of Jardiance. It's available as tablets of 10 milligrams and 25 milligrams. How does it work? Empagliflozin works on your kidneys and makes them remove sugar from your blood and remove it from your body through your urine. It also helps to lower blood pressure. It helps your heart pump better, and it also helps you to lose weight. What are the side effects of empagliflozin? All that sugar that's being removed in your urine creates a wonderful environment for bacteria to grow. So you have an increased risk of urinary tract infections, also an increased risk of fungal infections of the genitals. You have an increased risk of having your toes cut off. And then when your kidneys remove this sugar, they don't remove it as crystals. It has to be dissolved in water. So whenever you're losing sugar, a lot of water has to go with it. So that means that you have a higher risk of becoming dehydrated. There's a higher risk of falls from low blood pressure, especially if you're also taking water pills, diuretics, and if you're above the age of 65. Empagliflozin can also cause some damage to your kidneys. So let's talk about semaglutide, which you might know better under the names of Ozempic, Wegovy, and Rybelsus. All three of these contain the exact same active ingredients, but there are some slight differences. Ozempic is an injectable form of semaglutide that was developed to treat type 2 diabetes, but it's also now being used for weight loss. It's available in injections of 0.5 milligrams, 1 milligram and 2 milligrams. Wegovy is exactly the same thing as Ozempic. It's an injectable form of semaglutide, but Wegovy is available at the higher dose of 2.4 milligrams. And this is the one that's actually approved for weight loss. Rybelsus is also semaglutide, but this time it's in a tablet form, which you take once a day, compared to Wegovy and Ozempic, which you take once a week. Semaglutide stimulates your pancreas to produce insulin after a meal, which brings down your blood sugar. At higher doses, it slows emptying of your stomach, which makes you feel fuller for longer. And it acts on your brain, so you don't even feel like eating. Who's semaglutide recommended for? Your doctor may recommend semaglutide if you have diabetes and you're also obese, if you have heart problems, and if you have problems with your kidneys. What are the side effects of semaglutide? Common side effects, of course, include nausea, vomiting, diarrhea. You may have changes in your vision, especially if you have eye problems related to diabetes already. You may develop pancreatitis, that's inflammation of your pancreas. It's possible to develop kidney failure, and you might have problems with your gallbladder. You should not take semaglutide if you or members of your family have had thyroid cancer or multiple endocrine neoplasia. I've talked about medicines to lower blood sugar and their side effects, but you can reverse type 2 diabetes and bring down your blood sugar without taking any medicines at all. And I'll show you how to do that in the next video.